Thank you, Pat. Good afternoon, everyone. Bon après-midi, tout le monde. Today we have a new twist to announce in our own Yukon COVID story. Case number 8 is our first case that resides in a rural community. The patient is safely self-isolating and doing well at home. As for all our cases to date, this case is also linked to travel outside Yukon. Overall, we still have 4 of the 8 people who have contracted COVID-19 have now recovered and continue to do well. Aujourd'hui, j'annonce le 8e cas. Le 8e cas est le premier cas rural. Le patient reste en isolation et se porte bien à la maison. Comme pour tous nos cas à ce jour, ce cas est également lié à des voyages à l'extérieur du Yukon. A topic of much interest is how and why we choose to disclose community of origin of a case. My policy for COVID is identical to our approach for any communicable disease. Unless there's a compelling reason due to public risk, there is no need to tell others of the community. Both individuals and communities deserve their privacy, and disclosing identity of a community can quickly lead to identifying suspected individuals or their families. I have committed to a public health approach to COVID that is based on best current evidence and informed by experts either locally, nationally, or around the world. We listen closely to input from the public and from our leaders. However, our practices are not driven by public opinion. Likewise, community identity will not be revealed for reasons of curiosity or reasons that are not based on public health rationale. I'm well aware how we have been compared to other northern jurisdictions, and I do converse regularly with my dear friends and northern counterparts in Nunavut and Northwest Territories. Different jurisdictions make different judgments based on differing considerations and cultures. My decision is based on sound public health practice, the wisdom of locally experienced providers, and consultation with community leaders. When a case such as this arises in a rural setting, I do make a point of informing the relevant chief and possibly other community leaders, especially when I'm aware of information being passed around through public channels. Such conversations are private and do not reveal any personal health information or identifying details. Why do I go to such length? This, in my opinion, is the best way to keep leaders informed so that they can retain our confidence, their confidence in our approach, and help to allay community fears. Community stigma, or the fear of personal identification, could lead to individuals not coming forward for testing, and that is the opposite direction from what we want. When cases are identified, and we are confident in the containment process and the public health follow-up, then there's no change in risk to the public, whether in that or any other community. We in public health and in healthcare are charged with the handling of highly privileged information, and it is our obligation to protect that information to the highest degree possible. Remember, our risk for COVID at present is not coming from our next door neighbors. It comes from exposure to outside travel or from contact with these cases. However, our social spacing measures that we are all called upon to observe are designed to protect us from that undetected case of COVID that may be at any time among us. The risk to the public from COVID is ever present and does not change either up or down from these sporadic and contained cases. But please be assured, if you are at risk from a case, you will be contacted. And if we need to post a location of risk, as we have done in the past, we will continue to do so. Who would have thought a year ago that we would be observing the much-loved long weekend of Easter in this peculiar way? In today's announcement, we have added in several reminders to help you celebrate the spring holiday in safety. I spoke on Monday to some of the ways to help you keep a respectful distance from communities that really don't want tourists or visitors at this time. This is not a time for large gatherings or loud parties. But here are a few things you can do. Please go outside. Yes, visit with friends, keeping in mind all the new rules and advisories. Yes, you can use the playgrounds, being mindful of watching your children more closely. That means parents, heads out of their phones. The COVID news and the Facebook posts can wait. Kids, you can play with friends, but without wrestling in the snow. You can do adventure hikes, games, or Easter egg hunts in new, thoughtful, and well-spaced ways. You can visit seniors and elders if they want you to, and if you take extra precautions with distancing, they need your company. All in all, there's still lots of opportunity to be social. We all need that so much. And yes, keep washing those hands. A little bit in French on this topic. J'aimerais que vous célébriez ce long week-end avec joie et que vous avez autant d'air frais, de compagnie et d'exercice que possible, tout en respectant les règles de notre jour, en restant à distance des communautés rurales et en respectant les personnes âgées. Regarding media updates, in view of giving everyone as much rest as possible, I'm not currently planning a next media update until Tuesday. If we have important news to convey, we will post advisories, and I will speak to them as necessary. Hopefully we can all take a little break, but rest assured that our vigilance will not be diminished. Thanks, and I can take questions now.
Go to Tim from CKRW.
Hi, good afternoon, Dr. Hanley. I just wanted to clarify and follow up on a question that I had asked on Monday. Sorry, I'm losing track of my days a little bit. In regards to travelers and testing travelers, people coming into the territory now are, required as travelers, not just the flights. So are they a category now? Are they classified as travelers that would be subject to testing if they come through the now stepped up border measures and they are showing symptoms? Are they considered travelers now?
So Tim, just to clarify the question, travelers who are coming in with
coming into the territory.
Despite the new border.
Yes.
Yes. So the answer is yes. Our highest risk category remains travelers, whether international or from the provinces. So whether they're coming in although many, of course, are not coming in, there are returned Yukon residents coming, and other categories of people, including critical infrastructure workers, essential workers that are allowed to come in. And by all means, these are still highest priority for testing should they develop symptoms that are compatible with COVID. So they would screen in and yes, would be tested.
Okay, if we'll go to the phone lines now, we'll start with Gord, Yukon News.
Yes, with this case now being in the community, what is the, risk or possible effects it could have on the community?
The question is about with a case being in the community, what risk does that pose to that community? And there's maybe something I should clarify, and that is the difference between a case in the community and community transmission, because they sound alike, but they're actually very different. So just to be clear, community transmission means we find a case in Yukon that we can no longer connect back to either a known case or to travel into Yukon from outside, whether that's international or domestic travel. So we are not there yet, and we're hoping that we don't need to get there. But of course, that is always the thing that we are looking for with our testing protocols. So in this case of a rural community case that is travel related, the risk is no different from whether that were a case in Whitehorse. When we are satisfied that the case is connected to travel, that self-isolation measures have been carried out as they were in this case, that contact tracing contact tracing follow-up is underway, that relevant contacts are identified, then we are in just as good a position as we were with any of the Whitehorse cases to date.
Do you have a follow-up, Gord?
I do not. Thank you.
Okay, we'll go to Gabrielle, at the Whitehorse Star.
Hi. So I know that you said that you aren't planning on telling where or in which community the case is in, but based on your conversation with leaders in the community affected, is it likely that community members will be informed by their leaders? Is it on chiefs or leaders in municipalities to share that information if they want to?
The question is around who can disclose, and so of course if an individual or family choose to disclose, they have every right to do that. It may not be what our advice would be, but they have every right to do that. When I disclose information about a case to a leader, that is in confidence, and it is on the understanding that in turn that would not be disclosed to the community. Now, there could be particular circumstances where for a particular community or First Nation, it may be very important, and sometimes that's just to get ahead of rumors or panic. And in that case, I would expect that there would be a conversation with myself or my team to just work out a way to be able to manage that fear and panic. But no, I would not expect a private conversation as a kind of a heads up to lead to public disclosure of a case.
Gabrielle, do you have a follow-up?
I have a more general question about staffing at community nursing stations. My understanding is there is some rotation of nurses between communities. I'm wondering if the current situation means that there will be less rotation of nurses or whether nurses will be staying in communities for the time being.
So that's probably more of a detailed operational question that I could get back to you. What I can say is that when it comes to workers, including health workers who may be traveling into a community, the baseline approach is self-isolation. But as I said, for certain categories of healthcare workers where they're deemed essential, there may be exceptions to that. How that is actually being operationalized with the community nursing, I couldn't tell you.
Thanks, Gabrielle. John at Yukon News.
Yeah, so yesterday the government put out a release about the territorial parks opening and said that playgrounds were one of the things that Yukoners couldn't use. And then today the message is that playgrounds are fine to use. So I'm just sort of wondering, is there some sort of clarification there that I'm missing, or why the change of heart?
So there may be some clarification needed. So I will have to take that back and look at what message exactly was propagated yesterday. I have in terms of public playgrounds, such as municipal playgrounds, I have never made an order or advice against using playgrounds. The advice is to make sure that spacing and safe distancing are followed. So there may be, however, in the translation of some of those, that there may be aspects such as how that applies to territorial parks that may have come out with different operational requirements. So let me go back and we'll clarify that and come back to you.
Do you have a follow-up, John?
No.
Okay, we'll move on to Marin at Roboréal.
I'm okay, thank you.
Okay. Claudiane, Radio-Canada.
Yes, oui, en français, Dr. Hanley, si c'est possible de juste nous passer un peu les raisons pour lesquelles vous préférez ne pas divulguer l'identité des villages, des collectivités? Pourquoi garder anonymes les collectivités quand c'est fait ailleurs au pays, entre autres au Nunavut?
Oui, je vais expliquer en anglais d'abord. The question, which I'll answer in French, was about community identity and why we choose not to reveal identities of communities in which there's a case. Donc la raison, c'est pour deux raisons en particulier. La première, c'est pour protéger l'identité individuelle de la famille et de la communauté. On a entendu depuis beaucoup de temps, depuis des années, et selon la méthode qu'on a pour les autres maladies infectieuses, que ça peut être, les communautés peuvent être stigmatisées et la communauté veut que les autres respectent leur droit d'être sûr et privé. Donc, c'est pour raison de ne pas identifier le village selon la volonté des leaders et des gens des communautés rurales. Et en plus, en particulier pour COVID, ça peut pousser les gens de reculer, de ne pas avancer pour avoir les tests de COVID quand on a besoin, quand on veut que les gens se présentent pour avoir les tests COVID selon les symptômes. Donc, on ne veut pas que les gens se cachent pour la raison d'être, pour avoir peur d'avoir leur identité ouverte.
OK, just as a follow-up, toujours en français, de nous dire donc si les leaders, si les responsables des collectivités sont mis au courant du fait qu'ils ont des cas où qu'est-ce que vous suggérez que les gens doivent faire dans les collectivités s'ils sont inquiets qu'il y ait un cas chez eux?
Je n'ai pas tout à fait compris. C'est si les leaders sont informés, et je n'ai pas compris la deuxième partie.
Si les gens dans les villages, qu'est-ce qu'ils doivent faire pour se protéger ou qu'est-ce qu'ils doivent faire s'ils savent qu'il y a un cas chez eux?
OK. Donc, qu'est-ce que les gens doivent faire pour se protéger? Donc, si on avance selon les risques pour le public, les membres du public. Donc, si le risque ne change pas avec un cas, par exemple, pour ce cas récent, donc il y a pas une raison pour mettre les gens au courant. Donc, on va toujours, on avance toujours selon le risque pour le public. Mais parce qu'on sait qu'on a des rumeurs, des fois on a des gens qui se parlent, ça peut provoquer l'anxiété. C'est bien pour les leaders de savoir s'il y a un cas juste pour nous aider à calmer la population, à continuer d'avoir confiance dans le système et dans les moyens de poursuivre l'investigation et qu'il n'y ait pas de menace pour le public.
Merci, Claudiane. Chris, CBC?
Yes. My first question is about, I guess, given that you have said that local leaders are expected to receive this information in confidence when they have a positive case in their community, what do you expect? What are local leaders expected to do with this information, and what consequences are there if, as we've seen in the Northwest Territories, local leaders identify that there is a case in their community?
So this is a conversation of trust, and it's a conversation again that when leaders have an appropriate and very private heads up, they're in a position to help to calm their people and to be able to answer general questions about perhaps just linking back to us. How does an investigation occur? How do I know that the risk isn't increased for me? So it just, again, I have very frequent conversations with leaders and chiefs in general about where we're going in the epidemic and to be able to answer questions. So I rely very much on their ongoing leadership, which has been very strong to be appropriately informed so that they can continue to inform their people as well. So it just helps to continue that relationship of trust and confidence. If there is a breach, again, that is beyond my control. It is a prerogative that someone might choose to have based on individual conversations, perhaps from their family. I certainly don't give enough information for them to say much at all. Apart from there is a case in their community. So it would be very unlikely that they would go out with that. Beyond that, I'm not going to control, nor do I intend to control the voice of a leader or a chief.
Do you have a follow-up, Chris?
Yeah, I guess, can you hear me?
Yes, we can.
Hello?
Go ahead.
Oh, okay. I guess there appears to be some confusion about what your advice in terms of socializing and getting outside this weekend means. What's on and off the table for people? Like, can someone go to someone else's house? If they go to see elders, I assume this means that they have to stay on the other side of a pane of glass. Can you just sort of explain what you're expecting people to do this weekend?
I want people to be outside and to be able to exercise and to be social as much as I can within the limits of the advice and the rules that we have quite clearly laid out. And so you can refer to those online if you need to see them written down. The advice is follow the orders. If you're sick, you shouldn't be out at all. If you want to be able to visit seniors and elders, make sure that you have their permission, that you adhere to self-spacing. If you're sick, please do not visit seniors, elders, or anyone at all. It's all quite straightforward. I'm sorry if you're confused, but you can find it written down.
Thank you. Do we have time for one more question from the phone line? Does anyone have a final question?
Yeah. If I could add one more, we've asked about in the past about modeling, and Dr. Hanley has said that there's a small team working on modeling. I guess I have two questions. One is, when will those models be made public? And can you speak to whether those models are showing, like, how do the numbers of cases that we're seeing compare to what the models have predicted?
The first thing is, so the question is all about modeling, and the first thing I want to say is that we are not in a position in the very near future to release modeling data. But it's important to know that where the modeling that you're talking about, which is scenario modeling, which is based on where are we in the curve and where we are going in the curve, those models in the larger jurisdictions all start from 100 cases. So we are, it's 100 cases, and it is also when there is community transmission. So we are not even on the curve yet. So we cannot model on our own population when we're not even on the curve. And by the time, if we did get to community transmission with that many cases, it would be much less likely that modeling would actually tell us more than what we already knew. I think what we have to look for is different reasons for modeling in small jurisdictions, especially when we're this early on in the pandemic. So, for instance, we are looking at models of different scenarios as travel restrictions increase, of how that would look like. How does the risk change of incoming cases? So, how does the risk of COVID change over time as travel restrictions are in for longer and longer periods of time, and as the global and the domestic scene of COVID change? One of the other questions is how do we model the effect, the projected effect of the social distancing and the orders and all the measures we put in place to keep people physically distant, to close down places of congregating people like bars, altered business practices, closing of borders, so we're restricting travel. All of those have an effect, and we are also interested in trying to use modeling techniques to project the effects of those. And conversely, what would be the effect of opening up in certain areas? So these are a little different from the modeling that is presently being presented from some of the larger jurisdictions that are well into their curves and have enough data and reliable data to be able to project the curves. So hopefully that clears up the question of modeling, but it is an active area of interest, and as we have something to disclose, I would be happy to bring it to you, but it's not going to be in the near future, nor will it be that useful for us at this point in time.
Thanks, Dr. Hanley. Hi, Luke Smith from APTN National News. Of the 4 of 8, have they been retested? If so, will they be part of a regiment of testing and that kind of thing? And in the first testing, do we have any results or anything? Are we closer to knowing if they're...
So I think the question pertains to whether people who have recovered, who are deemed recovered, need to be retested. And although that was the original national strategy, that is no longer the case. So we determine recovered status by someone who is past at least 14 days from their symptom onset and no longer symptomatic. They're free of symptoms, and they're well. They previously tested positive. So having we no longer have to test them to prove, as it were, that they are recovered, as long as they've completed that period of isolation. There are some exceptions when it might be special cases, say ongoing symptoms that are not clear. There may be exceptions for healthcare workers who need to return, where we may need to try to verify testing. The reason that we don't do this is retesting is problematic because you can actually have basically dead molecular material that shows up as positive on the test, even though it's not active, and sometimes that can persist for several weeks. So you would be unnecessarily keeping people in isolation.
We'll go to the last question.
Hi, just wanted to get back to travelers for a second. There's going to be one potentially hopping into the territory this weekend. Given the 14-day self-isolation rule, what's your recommendation for the Easter Bunny?
Thank you, Tim. Well, I guess that's one that the kids are keenly tuned in for. I can tell you if I look a little tired, it's because I've been working overtime with not only the officials working for the Easter Bunny, but with the Emergency Measures Organization. And following New Zealand's lead, we have made a special exemption, and the Easter Bunny, appropriately dressed in protective equipment where required, but with ample spacing, will be making the rounds. I've heard that supplies may be an issue. They may be lower than normal, but be patient and don't get too close.
Thank you very much. Just a reminder, folks, that the next update from Dr. Hanley is expected to be Tuesday afternoon. Thank you.